Welcome! It's Ashley from Demystifying Your Health. I am so glad that you're here today. In this episode, we're going to be talking about GERD. You're relaxing in your favorite chair after dinner. All of a sudden, you have this burning sensation in your chest and this awful taste in your mouth. When you think about it, you notice this has been happening more and more frequently, especially if you go to bed soon after you eat dinner. What is this? And how do you stop it from happening? GERD, or gastroesophageal reflux disease, is when your stomach acid and contents flow back into your esophagus. This is not supposed to happen due to a small sphincter, which is at the bottom of the esophagus. Keep in mind, your esophagus goes from your mouth down to your stomach. The sphincter sits just above your stomach. And what it's designed to do is to allow food to pass through, but not come back up. If the sphincter is not functioning properly or is weakened, then you get the reflux. And this causes irritation of the esophageal lining, the little tissue that lines your esophagus that helps everything pass smoothly. So when this happens, obviously it causes a bunch of different symptoms. And if it happens in the long term, it can actually result in the lining being worn away, which leads to numerous complications such as bleeding, esophageal cancer, and other things. Some symptoms, though, of GERD are heartburn, that burning sensation in your chest, a sour taste in your mouth, actual full-on chest pain, difficulty swallowing, dry cough, hoarseness, sore throat, regurgitation of food or stomach acid. Obviously, you can have that where you have the food sort of come back up, and a sensation of a lump in your throat. And while it's not uncommon to have heartburn from time to time, I mean, we all get it, right? It becomes concerning when it happens frequently. You should seek treatment if it's happening more than twice a week or if your symptoms are disrupting your daily life. So let's dive into what those treatment options are. When it comes to treating GERD, the first step is usually over-the-counter medicines. The good news is there's a lot of them, but also this makes it confusing as to which ones you should try. So let's take a closer look at them now. The first group is antacids, and these neutralize stomach acid, such as Maalox, Mylanta, Tums, or Rolaids. And these are very fast acting, so if you're having, an upset stomach with heartburn immediately after eating, you probably want to take one of these, so that's going to help reduce the symptoms. Then you have H2 or histamine blockers, and these reduce acid production. This can include Tagamet HB, Pepcid AC, or Zantac. The third group is proton pump inhibitors, or PPIs. And what these do is they actually block the production of the stomach acid. And they include Prevacid or like Prilosec, something like that. The last two groups are considered maintenance groups, which means that you need to take them usually frequently to help just keep the acid down in general, which should help reduce your symptoms. So if you're, as I said before, having, immediate heartburn, this is where the antacids are great because they work so quickly. These work, they just take over time to work because of the way they work in the body. And the nice thing about these two is they also come in prescription strength. So that means what if over the counter, if it's helping but not helping fully, then your doctor can prescribe you something that's a little bit stronger. And usually there is taking as maintenance medicine, which means you take it at least once a day in order to be able to get the benefit. And that's if your doctor is prescribing it for you. If you're taking any of these over the counter and you're taking them more than twice a week, that's when you should be seeing your doctor to find out what's going on. And if you need to, your doctor can give you a medicine called baclofen, which is a prescription medicine that's designed to help strengthen the sphincter. So that way it actually strengthens the muscles so you're experiencing less reflux. In severe cases, if your doctor would recommend this, they might say surgery to help fix whatever the problem is to reduce the amount of reflux you're experiencing. The good news is for most people, they can take over-the-counter medicines, and that is sufficient in order for them to be able to, go about their daily life with reducing their GERD symptoms. There are several ways to prevent GERD from occurring. The first is to maintain a healthy weight. People who are overweight tend to have more episodes of GERD than not. You also don't want to smoke, because obviously when you're smoking, you're breathing in, and that's going to irritate anything that's inside your throat, including your esophagus. And you want to avoid foods that obviously trigger reflux, and this can include things like fatty or fried foods, tomato sauce, alcohol, chocolate, mint, garlic, onions, and caffeine. Pretty much all the good stuff, right? Well, it's important until your GERD gets under control and that obviously your esophagus heals, you want to avoid these as much as possible. It's also helpful to eat smaller meals. Smaller portions mean that your stomach is going to be less full, which means there's going to be less opportunity for reflux. And you don't want to lie down after meals for at least 3 hours. This is going to allow your body enough time to empty out your stomach before you lay down, which is reducing the chance of reflux. Same thing with elevating the head of your bed. About 6 to 9 inches is enough to bring you up. That way you reduce the chances of stomach acid flowing back up your esophagus. And the last important step is not wearing tight-fitting clothing. When you wear tight-fitting clothing, it actually can compress your stomach and make it, be squeezed, like you're, in that sense, the contents back up your throat. So with following all these steps, you should drastically reduce your chances of having GERD. Well, experiencing heartburn from time to time is annoying, and it's going to get better, but if you're experiencing it frequently, this is where you want to make sure you get treatment. So that way you don't end up with significant complications and you can enjoy life, right? That's what this is all about, is being able to enjoy life. So thank you guys for joining me today. Hopefully you liked the information. If you did, please like, share, subscribe. If you have questions, comments, put them below, send me a message. I'd love to hear from you. And until next time, stay healthy.